All, welcome to one more show. This is Dr. Mubin Sayed. With me, Professor Dr. Paul Marik. You already know him. He has been here many times. So, a rock star, I think the kings of the kings is here. So, uh, Professor Dr. Paul Marik, welcome.
Thank you, King Bean, and it's always a pleasure to be with you. You're one of the smartest people that I know.
Thank you. So, for new cool beans, new audience, tell us a little bit about yourself, and then we would ask some questions about what's going on.
Sure. So I'm an intensivist, critical care medicine. I've been practicing for 35 years. I'm currently professor of medicine and chief of pulmonary critical care here in Virginia. I'm also the medical director of the ICU at Centaura Hospital. Those are my kind of credentials. I've published, 4 critical care textbooks, over 500 peer-reviewed journal articles, and my interest is critical care, and more recently, COVID. We developed the COVID guidelines, and we formed the Frontline Critical Care Consortium, where we've, provided guidance on the treatment of COVID through all the stages. And I think most people know about the FLCC, and if they don't, you should go to our website where we have a lot of useful information.
Very good. Thank you very much for the introduction. So I'm going to dive right in the current status. So tell me this. Very recently, we heard about a lawsuit. We heard about Centaura Hospital. So how about we start from there? That what is the latest in your management approach and in the pushback?
Yeah. So, basically, I've been using a version of Meth Plus since the pandemic began in April. And, Meth Plus has evolved with time as, we've learned new medications. And also, Delta is a very virulent virus. It reaches very high concentrations and is profoundly pro-inflammatory. So we've had to, adapt Meth Plus. So more recently, we've added fluvoxamine and we've added anti-androgen therapy to our protocol, just because corticosteroids themselves do not seem effective. And you see on the table there, we add dual anti-androgen therapy, we add melatonin. So we think these components are all really important. The standard of care, or what the standard is in the US and what our hospital is recommending, is remdesivir. And as we know, remdesivir does not improve patient outcome. It increases length of stay. It increases toxicity. It increases renal failure. It does not improve outcome. In fact, it was used for Ebola, and it had to be withdrawn because of an increased risk of death and toxicity. So basically what's happened is the hospital now has banned me using the components of Meth Plus, which is ascorbic acid. For somehow it's toxic, although 2 recent randomized controlled trials have demonstrated its benefit. I'm not allowed to use fluvoxamine, and I'm not allowed to use anti-androgen therapy. What they want me to use is remdesivir, which, as I said, is a toxic, ineffective drug. They want me to use dexamethasone in low dose. So this is really unprecedented in the world, because the doctor at the bedside is the one who decides on what's best for his or her patient. He takes responsibility for the patient. He understands the patient. He individualizes the patient. And, that's the way I've been practicing medicine for 35 years. And no one has really interfered with me. And that's the way clinicians across the whole world practice medicine. We're not telling doctors how to practice. They're the ones that decide. They weigh up the evidence and they decide what they think is in their patient's best interests. So now the hospital is coming around and telling me what I can and cannot prescribe for COVID. So this is completely outrageous. It goes against the very core of the patient clinician relationship. It goes against the very core of Hippocratic medicine, because we have these people who have limited or no experience with COVID telling an experienced clinician how to practice medicine. So unfortunately, as you know, this is not just a local thing. This is becoming more widespread in the US and across the world. So I'm doing this obviously because I had no option. And I'm doing this for doctors across the world and in the US because, we need to bring medicine back to doctors.
Got it. Thank you very much. Can I show that letter that you had received from the
Sure.
hospital?
Yes. So this was an email that Dr. Bundy sent to the entire healthcare system, but you can see it targets me. So basically, they're telling us we can use remdesivir and we can use tocilizumab. Those are recommended, although as we know, they're ineffective. If you then carry down, they go, corticosteroids, you can use 6 milligrams of dexamethasone. Okay, go down further, a little bit further. And then this is, there we go. You can just stop there. So this is the do not endorse section, which includes medications that may cause harm, and its efficacy safety is not supported in peer-reviewed, published, randomized controlled trials. And as we'll see, that is a complete lie. And these medications will not be verified or dispensed for prevention or treatment of COVID. Ivermectin, bicalutamide, etoposide, fluvoxamine, dutasteride, and finasteride. And that these medications should only be used if patients are enrolled in a clinical trial. And then they go on to say ascorbic acid is not endorsed for the prevention or treatment of COVID-19 or sepsis or septic shock. So basically, they tying my hands and preventing me from using these medications. So, fluvoxamine is probably the best one to talk about. So, they say it may cause harm and is not effective. It is not supported by peer-reviewed published RCTs. So we know that's completely wrong. So there was one of the earliest studies with fluvoxamine published in JAMA. So that's Journal of the American Medical Association, showing the benefit of fluvoxamine in patients with COVID. More recently, there was a large platform randomized controlled trial published in Lancet. I would assume most people would agree Lancet is one of the most prestigious peer-reviewed journals in the world. It was a randomized double-blind platform randomized controlled trial, again demonstrating the benefit of fluvoxamine in patients with COVID-19, decreased hospitalization and death. More recently, there has been a randomized controlled trial done in ICU patients showing a marked reduction in mortality with fluvoxamine. We're not going to talk about ivermectin because, I think it's not a scientific debate anymore. The science is clear. It's become a political issue. We know that ivermectin is effective. And just to add one thing, ivermectin has been approved in 79 countries in the world for the use of ivermectin. The Tokyo Medical Association in August basically recommended the use of ivermectin for every patient with COVID in Japan. So somehow ivermectin is safe and effective in Japan, but in the US, it's a toxic deworming medicine.
And I wanted to make a comment. My apologies for the interjection. When we talk about science, isn't this in the very first place, having somebody else interfering with the doctor in itself a breaking of the scientific methods?
Absolutely, because the doctor, it's not like we're using experimental medicines. It's not like we're experimenting on patients. These are all FDA-approved drugs. And, maybe it will come to that. These drugs are used off-label. But what people may not recognize is 40% of drugs used in the ICU are off-label. And in fact, prior to COVID, the FDA promoted the use of off-label drug. So just to go through what an off-label drug is. So when a pharmaceutical company applies to the FDA for licensing, it's usually for a specific indication, and that's called the labeling of the drug. So if you read the package insert, it tells you what it's indicated for, and pharmaceutical companies can then only advertise for that specific indication. But many drugs are used off-label, which means you use it for an indication that's not on the labeling. Now, probably the best one is aspirin. So most people know what aspirin is. If you use aspirin to treat atrial fibrillation, that's an off-label use. It's done every single day throughout the entire world. It's off-label. Nobody has ever questioned the use of aspirin for atrial fibrillation. And there are many drugs that are used similarly. Amiodarone is a very common antiarrhythmic drug. It's used for ventricular arrhythmias. That's its indication. But it's been found to be very effective for atrial fibrillation. It's probably used more commonly for atrial fibrillation, but that's an off-label use. And it's clear, the legality is clear. Doctors can use off-label drugs using their best judgment. They do not need informed consent. In fact, getting informed consent would only confuse the patient because it would, increase their anxiety. Patients don't understand this, and it would be technically impossible to get consent for every off-label drug you use. So it's standard of care to use off-label drugs. So the drugs that I'm using are all FDA approved. These are all FDA approved drugs which are used off-label, which have been proven to be safe and effective for COVID. But my hospital does not want me to use it. They would rather I use remdesivir, which costs $3,000 and does not improve patient outcome. So you can see why this is an outrage, and I had no option. I was in the ICU the week of October the 25th after this awful imposition, and I had patients who had deteriorated on the floor. So obviously they had got remdesivir and dexamethasone, and they hadn't responded. And obviously, as we know, doing the same thing once a treatment fails is idiotic. You have to change the treatment. So, I needed to escalate the therapy and add additional medications, and I was prohibited from doing so. And I had to watch as my patients died without being able to give them the fluvoxamine, IV ascorbic acid, and anti-androgen therapy, as well as other therapies that I would have liked to add. So, it's an outrage.
So tell me this. So I'm just thinking aloud at this time. I'm sitting with my patient and I'm treating them, and a third person comes in and says, here is a letter. You would only treat with what I've written in this letter. Then do you really need me? Can we not just have anyone sit here and execute the protocols? Then why are doctors really needed?
Absolutely. I mean, you asked such a good question. And the answer is every single patient is different. I've never had two patients the same. That's why you need a doctor at the bedside who examines the patient, evaluates the patient, looks at the patient's labs, and decides what's best for the patient. You cannot treat patients by protocols. It just doesn't work. That's not how medicine works. Otherwise, as you say, it would be simple. You wouldn't need a doctor. We would just have, patients put in their symptoms and the computer tell them what medicines to take.
Very interesting. So tell me this, and just a side note, I was also sent a letter very similar to this by some of the agencies working with me. And they also just made up accusations, such ridiculous, laughable accusation, made up, that you look at them and you say, this is not even medicine and this is incorrect medicine that they're saying. It is a very similar thing I'm seeing over here, that first, they should not have interfered. if they have interfered, which basically is the first thing is wrong, then they are putting together something that in itself is wrong as well. This, I do not know how you take it. It makes my blood boil sometimes when I think about these things happening to you, happening to me, and to many other. I want to ask you this.
Yeah, so
What is
what's
your
most, sorry to interrupt you, my friend. So what's most upsetting is that they could have spoken to me. They could have been adults and say, hey, why are you using these medicines? Let's talk about it. Let's find some common ground. But no, they couldn't be adults. They had to send this childish, threatening, email, which was really, I mean, directed at me personally, which just gives you an example of how completely upside down our world has become.
To me it is, I mean, you're being very polite to them that they are not being adults. When I received this, so I received a similar letter in which, number one, they said we're going to cancel you, and number two, the accusations that they had made were all incorrect. And I knew that they actually wanted to target something else in my content, but they were not rising up to name that thing, and they were just picking up incorrect things in other places. And while they're doing it, they were wrong. And I was thinking, they don't even have the courage to come to me and say, we don't want you to do this, and then we can have a discussion to do that or not. Instead, they are just making up false things and then sending them to me. It seems very similar practice here as well. I
Yes,
want
no,
to ask,
I agree with you. It's completely lack of courage. It's rude. It's offensive. It's immoral. And, that's not the way adults behave. Professionals shouldn't behave like this.
so then what is your discourse? What is your way to say, I want to practice medicine? That's what my expertise is. I'm going to help my patients. I should be allowed to help my patients. How are you managing
Yes.
that?
Yeah, I had no option. My hands were tied because it seemed this was non-negotiable. They didn't speak with me. I was not getting help from anybody else. I did get legal advice before I was in the ICU, and the very smart lawyer said, "There's really nothing you can do. Go to work, just document what happens, and then see what happens." And I did that, and it was an absolute horrific experience. Horrific, because I was not, in the first time in 35 years, I wasn't allowed to doctor. I had to stand by helplessly as patients could not get the treatment that they deserved. Now, whether I could have saved all of them, I don't know, but at least I would have done my darndest to do so. I think that's what doctors do. Particularly in critically ill people who die, you do every single thing possible to save your patient's life. I think that's what doctors do. And I was prohibited from doing that. And at the end of the week, it's very tiring looking after COVID patients. At the end of the week, I was absolutely emotionally and physically completely overwhelmed, and really got no support. So the options were to quit or to file a lawsuit against these people. Fortunately, I was able to find some very supportive lawyers who were as equally outraged by this prohibition as me. And they've obviously helped me put together this lawsuit. So, it will be in the judge's hands tomorrow. The hospital has tried to have the case dismissed on really frivolous grounds, which I suppose is typical. They don't want to take responsibility, so that they try to get the case thrown out on really technicalities, which didn't really work. So, we're going to go to court tomorrow, and we'll see. And, whatever the outcome is, at least I know I've done what I had to do. I couldn't stand by idly watching this terrible charade carry on. I had no option.
So good luck to you, and let the medical practice win and not the protocols. Sometimes I used to think that protocols are actually reducing the capability and the skills of a doctor, because they don't have to think more and they can just pick up a paper and say, this paper said do this, yes, no, I'm going to do this, and that's it, and my job is done and my liability is gone. But where are those thinking doctors who look at symptoms, signs, labs, and then make up their mind to say this is what is happening in terms of mechanical things or chemical things or electrical things, and this is what I was taught, ton of medicines and procedures and methods, and I'm going to use them to try to help. What happened to that?
Yeah, so we obviously trained in a very similar kind of environment. I mean, my teachers were the most, astute, profound, intellectual clinicians that I've ever come across. And, we would examine patients, we would talk to patients, we would be clinicians at the bedside. That's what the way I was trained. We didn't do multiple choice exams, we did clinical exams because that's how they tuned our clinical skills. It seems that being a bedside clinician is becoming something which is, I'm a dinosaur, it's extinct. It seems like patients come into hospital, they go through what we call the diagnostic donut, which is the CAT scan, without even getting a history. What's wrong with you? It could be my big toe. No, they go through a CAT scan and they don't talk to patients and they don't examine patients. It's worse than veterinary medicine. And that's the way medicine is being practiced. Whereas, the art of medicine is as important as the science. And you have to blend the art and the science together. That's what makes a really good clinician. You have to have both. And, I'm very fearful about the future of medicine, because, and this is an example how, faceless bureaucrats and inexperienced people are telling, I've been doing critical care for 35 years. They're telling me how to practice medicine. It's awful.
Maybe, absolutely. And now I'm just going to have a little levity. Maybe in the future, there would just be some call centers. You call into them and say, the patient, this machine diagnosed my patient with this. Now we have fed you all the protocols, like scripts in the call center. Please read the protocol out to us so we can just administer that to the patient. That is how degraded. Again, call centers are not degrading. The practice of medicine, that is how it is degrading. That it looks like the need for thinking is being removed and just scripted. And then even the script is not coming from someone who is skilled enough and eligible to give a script to say, I can tell you, just like you have math plus protocol, it is coming from some thinking. It is coming from a doctor instead of these places. So tell me this.
So, you raise a really interesting question because, I do rounds with students and residents, and I say to them, the problem with you is you don't think. You spoon fed and you don't think, and I'm going to make you think. So I ask them questions to make them think, let them use their brain. I think the brain is the least used organ in the body because students don't use it. They spoon fed, and if you ask them to think, they can't think. But that's the way I was taught. My teachers would ask me a question and ask me to think about something. Why is this happening? Why is the blood pressure low? Why is the gallbladder doing what it's doing? Why? Think about it. And these students can't think. They've lost the human ability to think.
And one of the biggest compliment I used to get for my lectures, which they're trying to cancel at this time, used to be from doctors, nurses, NPs, PAs, medical students, that what we learn from you is the mechanism itself, and that makes us thinking. We become thinking clinicians instead of cramming a set of recipe for a disease and just going and trying to execute on that.
Yeah, so your drawings are phenomenal, and if you understand the pathophysiology, if you understand the physiology, you know how to treat the disease, but you've got to understand the physiology. Why is it happening? And COVID is a really good example, is that you have to understand the disease to treat the disease. You have to understand it. You have to understand the pathophysiology. You have to understand the pathology. Once you understand that, then you can understand how to treat the patients. But you have to understand the underlying mechanisms. It's just so fundamental. And, people do not understand COVID. We're 18 months into this pandemic, and it's truly astonishing. Most people don't understand the disease. And what you do is just delightful, because you make it simple. I think a good teacher is someone who can make a difficult subject quite simple. A bad teacher who is someone who takes a simple subject and makes it so complicated no one understands. So you want to translate it into a way people understand, and you do such a wonderful job. I watched your video on curcumin, because I think it has a role in COVID. It was excellent. It's brilliant. And, I learned something. And I think it's a tragedy what's happening in our world, because, things are being turned upside down.
And
You're
just to
you're a
add to
brilliant
that,
teacher. You're a brilliant teacher. And it breaks my
thank
heart
you,
what they're doing.
thank you. Do you know that this is one of the objections, that your teaching is so simple that it is not even for nurses? They used nurses as if nurses don't need to understand, or they understand differently. And they said it is definitely not for doctors. And I do not know where to take my distaste of such language and tell them how wrong they are. So simplifying the concepts so they can become recallable and sticky and easy to understand and easy to think about, they used that to insult the whole medical community. This was just, anyways, it's not about me at this time. So tell me this, are you comfortable a few more minutes if we can take some questions?
Sure.
Okay, so I'm gonna go in here. So cool beans, if you have any questions, please write them down, and I'm just gonna quickly. So tell me this. One question from me while we are getting questions from the cool beans here. In light of what is happening, is your own career at stake as well?
Yes, I think so. Obviously, I put my neck out and haven't got a tremendous amount of support. But you know what? Sometimes in life, you just have to do what you have to do. I had a ethical and moral dilemma, and I had no option. Fortunately, I'm nearing the end of my career, and so I can take up washing cars or cutting the grass. So
I will join you as well, because they're trying to cancel me as well.
So, there are some other options, but certainly going into this, I knew this could be a career-ending endeavor. But you know what? Somebody has to stand up and do the right thing. And, Ignaz Semmelweis is my hero, because, he made, enormous advances in our understanding of medicine. He was treated as an outcast. And only after his death did they recognize how brilliant he was. So, it's just suppose part of life. I just have to do this. I had no option.
I think I should sue them as well. So I have a few questions here. This is the most commonly asked question here. Paul T says, where can you donate dollars to the lawsuit?
Yes, no, we're very grateful for people who help us in this endeavor. So you can go to flccc.net, flccc.net. So this is a non-for-profit organization that, helps us do what we do. And, every single dollar counts, and we appreciate, everyone who donates, because, we're a very small group. We use the money wisely. And we obviously, fighting some very, very, influential people, but we have to do what we have to do.
Got it. Thank you very much. So there's a question, and totally up to you to answer the relevant questions or pass on the drug nitazoxanide from the FSCC protocol is an antibiotic, an antiviral antiparasitic. Does it kill off the good bacteria in the gut like others? So looks like a slightly different
Yeah, that's
topology.
fine. I can try answer that. So, I mean, it is a good question. I mean, it's much like ivermectin. The two drugs actually are very similar. They're both antiparasitic drugs that have antiviral activity and anti-inflammatory activity. They do work differently, the mechanism of action. As far as we know, that does not, neither drug actually interferes. And in fact, the opposite is true. We have some data from Dr. Sabine who actually shows that ivermectin actually increases bifidobacteria. And bifidobacteria is one of the really good bacteria that gets depleted with COVID. So in terms of nitazoxanide, I don't know. I would imagine it wouldn't alter much the microbiome because of its mode of action, but without question, ivermectin is very good actually for the microbiome.
Got it. Thank you. A few comments. So one for Best Dr. Drbeen, you're both such excellent examples of living your dharma. Thank you very much. Countersuit Inc. I think I have a suit that I should do as well. Okay to let go says no retiring. Nancy says integrity. Ninja says you save lives. I have proof today. So if I continue, Linda says we are grateful for your life. So let me just quickly see.
So, if people want to do this and, this is on their own accord, you can send an email to Centauro. They have an ethics, it's bizarre. They have an ethics email address called Centauro Ethics, Centauro Ethics at ethics.com. Yes, there we go. It's kind of bizarre because what they're doing is completely unethical. But, if you want to, you can, on your own accord, just email them and tell them, what they're doing is profoundly unethical.
Got it. Thank you. Next question is, what do you say about monocyte carrying S1 protein 9 months after COVID vaccination?
Yeah, so this is a really interesting question, and this is based on Dr. Patterson's work. And you're right. This is why the spike protein is a bad player. And, what he's discovered in post-COVID patients is that they have activated monocytes which carry the S1 protein and which activates the monocyte. It's very troubling. COVID's a really bad player. And, we need to do everything we can not to get COVID and to stop it in its tracks because spike is really bad. And it seems like this virus is just mutating. Maybe, pressure from whatever reason is causing this virus to mutate in a form that is more infective, less susceptible to neutralizing antibodies. So, this is a major issue. And I think I'm not optimistic, I must tell you. I don't know where we're heading. But this is really, we're not in a good place. And I think this pandemic has been grossly mismanaged by, federal and local agencies. I think it's awful.
And if I can add to this, I think not only grossly mismanaged, I think it is still continuing to be mismanaged. We haven't learned our lessons.
Yes, you're absolutely true. We 18 months into this pandemic, or near 2 years, and people just don't understand the disease, and we haven't learned. And Dr. Fauci's a bad player. He's telling people how to manage this disease. He's never treated a COVID patient, and he has profound conflicts of interest. So, the major, the FDA, the CDC, NIH have failed miserably.
This question, which I have seen in various ways here and there on Twitter as well. Does Centara believe that Dr. Marik is anti-vaccination? Oh, this all about ivermectin. We know that Dr. Mobeen Sayed is not against vaccination, yet he is targeted due to his associations. So,
Yeah, so that's a good question. So I have been vaccinated and I have been accused of being anti-vaccination. I've been accused, which is false. False. I've been accused of encouraging our nurses and residents not to be vaccinated, which is false. I've always said this is a personal decision. I don't tell people whether they should be vaccinated or not. In fact, we had a fellow whose career was in jeopardy. If he didn't get vaccinated, he would have been booted out. And I encouraged him to be vaccinated. So they may think that I think they do think I'm anti vaccination, but that's false. And this is just not about ivermectin. You know, ivermectin was banned by this institution last year. So this is even beyond ivermectin and beyond anti-vaccination. But the question is right. Basically, I'm being labeled as an anti-vaccination person. And obviously, that's grotesque. I mean, being anti-vaccination puts you some kind of a monster. And that's the category that they're trying to lump me into. And I believe in the First Amendment. I think people have the right to decide for themselves. We should be able to talk about stuff. We should be able to communicate. We shouldn't be censoring everybody. And I think you can't force people into something they just don't want. That's what they did in Nazi Germany, and we should have learned from that.
thank you. Kara says, in addition to financial support, how can we help you to stay with us? We need you and your leadership now more than ever. Heartfelt thanks.
Yeah, so obviously what keeps me going is people like Kara who give us encouragement because there are some good people out there, and that is very encouraging. So I'm very grateful to all the people out there. Just show your support. You can donate to us. You can send us emails. You can send emails to that awful place. Tell them what they're doing is wrong, and tell other people, because I think this needs to be a ground movement, because I think people in the US need to know what's happening. I don't think they realize all the bad things that are happening, and there's a lot of badness going on, and Americans are not being told the truth. In fact, Earth people, us, we're all in the same boat. Earthlings, we're all Earthlings. We're not being told the truth, and I think that's the biggest failure. You need to tell the truth. Be truthful. If you tell the truth, that's the best path forward, and we're being lied to. And
Absolutely.
so I think we need to group together. We need to be a voice together. We need to object together, and we need to stand together. And I think the more people that know about this badness, the better it is.
Totally agreed. And I think this is an important thing, because what they're doing is they're lumping people in various things and then they are bringing them down one by one. For example, for the cool beans, Dr. Marik and I was talking, and I was showing him a document of accusations on me, which were, I was Googling him the concepts. I know that he already knows them. And I was showing that how inaccurate the accusations were. And then the folks who made those inaccurate accusations are now trying to shut down the business. And Dr. Marik said, why have you not sued them? And I have not thought about suing them. I do not have enough resources at this time to go after them and sue them. These are bigger forces at play. But they are able to get people down one by one. And I think, thank you very much for at least going back, suing them back. And thank you for everyone who's helping Dr. Marik. I think at some point this has to be stopped, what is happening. It has just become too easy for these folks to just go knocking things down. So Soren says, could you tell us some consideration regarding mast cell activation in COVID?
Yeah, so that's an interesting question. So for people who may be interested, we actually wrote a paper on the scoping review on the pathophysiology of COVID, which is a very complicated disease. I must confess, I think it's the most complicated disease that we've ever encountered. And every day we learn something new and important. So I think that the macrophage, the monocyte macrophages, are the most important cells that become activated. But there is data that mast cells too get activated directly and indirectly by the virus. So it's very difficult to tease out how much is due to the macrophage and how much is due to mast cells. So, we still working forward on that. But I think, we recommend that you treat both. So that's why famotidine is a good drug, because it's an antihistamine and it may have some antiviral properties and anti-inflammatory. So particularly in our long COVID, we do recommend the use of antihistamines because we don't know. I think there's a lot we don't know. And I think we need to admit that we don't know. And when you don't know, you try different stuff.
Got it. So one last question. I know that you have a time frame as well, so we are at that time. One last question, and then we can stop. So Buzz Nightgear says, do you think most of the government policy makers have a monetary benefit for pushing vaccines and keeping real repurposed medicines on the people just for gain?
Yes, my dear Buzz Knight, you've hit the jackpot. I think that is what's behind this all, is that this is really a war on repurposed drugs, because nobody makes any money from repurposed drugs. And what they want to do is sell vaccines and expensive designer drugs. That's what this is all about. I have no question this is not about ivermectin or Dr. Mobeen or myself. This is a war on repurposed drugs by Big Pharma and their collaborators. And many people in these agencies have profound financial ties to Big Pharma. And I think it's absolutely clear. So, we're going to see these new antivirals by Merck and Pfizer. I can tell you they're going to cost $800, $1,000 compared to $2 or $3 for ivermectin, which is just as effective. So this is all about money and profiteering. Has nothing to do with humanity or saving lives.
One last question. Apologies. This is it. Dr. Corey has said that at the Florida summit that patients should have a doctor administer the first and second line treatment for IMAS Plus. Any suggestion for finding a local doctor?
Yes, Tom. So, this is the problem, and hopefully we're trying to change. This is what our lawsuit is about. There are lots of doctors who are scared. They're scared about prescribing these drugs, which doesn't make sense because, as I said to you, that it's perfectly legal. The Nebraska Attorney General has come out and said it's perfectly fine for doctors and pharmacies to dispense ivermectin and hydroxychloroquine. It's illegal not to. So I think that there are doctors who are fearful. And so I think you need to find a doctor who cares and is prepared to do the right thing. And if they aren't, you've got to find another doctor. It's hopefully the tide will change, and that more doctors will be more enlightened and realized how they've been lied to, which they have been lied to by the agencies.
Got it. So thank you very much. I'm going to give you the last word as well. So what is your message before we close? And thank you so much for being here. Cool Beans, thank you very much for being here as well. We will not have a session in the evening because this would be the session, the highlight for the day. And tomorrow is my off. I'll see you day after. Dr. Marik.
Thanks, my friend Mo. So basically, what I want to say to anyone, this lawsuit is not about ivermectin or meth plus. This is about the sacred patient-physician relationship, and that physicians should be allowed to do what physicians have been doing for decades, is look after their patients to the best of their ability. And once political and other forces intervene, it has a really negative effect on patient outcomes and the whole patient-physician relationship. So that's why I'm doing this. It's not about ivermectin. It's about doing the right thing. And hopefully we can, this can be the start of a change in this country and across the world, because I think doctors need to take medicine back. And I thank my friend Mobeen, and I thank all of you. And please support us as much as you can.
Thank you very much. So we are with you, and folks, flccc.net, if you would like to go there and donate and support and see Dr. Marik's work. Thank you very much for your work, Dr. Marik. Thank you very much for your time. Good luck to you, and we are with you.
Thank you, my friend.
Thank you. Cool beans. Bye-bye. I'll see you day after tomorrow.